All right, so it is the second shop we are entering inside the Junction Mall. This is the JMall Live with me, Mr. Hansen. And as you can see, we are inside Life Health Care. So let's see what we have in Life Health Care. And then we see. So I'm with here with Doctor, your name?
Yeah, Dr. Okran.
Dr. Okran.
Yes,
All
please.
right, so Dr. Okran, Life Health Care, what is it all about?
Oh, it's a setup, right? Junction Mall
Mm,
inside the mall pharmacy.
okay,
And basically, what we do is that we try our best to give the patients the best health care
okay.
because their health is our concern. And that's what we try to do here. So we offer different services here.
Mm,
And the services we offer here are both medical and dental.
okay.
Alongside, we have some specialist clinics that run along. That's optical, that's for the eye,
Mm,
and then gynecology. That's basically for the female reproductive system.
good.
Yeah, so that's what we offer here.
So beautiful. So with all that you've mentioned, I believe we have laboratories for that effect.
Yes, please.
Yeah.
Under the medical, then we have laboratories.
Okay.
So we run a lot of lab tests, including blood, urine, stool, semen, by excluding corona. We don't run corona test here for now.
Okay.
Yeah.
Okay. So for now, we want to look at the optic testing because you can see we have some lenses here that
Yeah.
you sell.
If you don't
So
mind, we can take you
good,
around.
good,
Sure.
good. So let's go around. So join us as we tour Life Health Care.
So
So
when you get in,
okay.
we first do a small triage. Triage is like we need to assess you briefly to make sure that everything is fine. Your
Beautiful.
temperature okay.
Beautiful.
At least you're wearing a face mask and everything. We check that at the door, then you come in. So this is our reception.
Okay.
All right.
All right.
Then we get your card, your details, whatever it is. You can lodge your complaints here. Then we know where to direct you.
Beautiful.
Whether it's going to be medical, dental, or even just a simple counseling.
Okay.
Then we know what to do.
Okay.
So this is the reception area.
So beautiful. So they don't only do one thing here. These are some of the things that they do. So there's a reception. When you come, you lodge your complaint. You can see the big books out there. These are not books of heaven, no. These are the books of life care. So when you come, you lodge your complaint, whatever thing you want. Perhaps your eye, your teeth. The caca is there. Try they will sort you out here. So this is it. So
We have
doc.
our
Mhm.
receptionist here called Tilly.
Okay.
Yeah.
Tilly, how you doing?
I'm fine, and you?
I'm doing good. So what's it about life care?
Oh, this is where everything that has to do with your health concerns us. So we are here for you.
So basically, when customers approach you first, you being the front desk personnel, what are some of the major things that they bring to your doorstep?
Here we take care of general medical issues. We take care of dental issues, optical issues. So it depends on what the person is coming for. Yes. So you come, I ask you why you are coming here, and then I usher you in to see whoever you want to see.
Do you have to pay any money for registration or anything?
Oh yes, we take insurance and we take cash.
That's the national health insurance.
No,
No,
private insurance.
private insurance. Okay, yeah, because we need to be specific.
Oh
Yeah.
yes, private insurance. So if you have a private insurance, we take it. Example, Acacia, Apex. Yes, and then we take cash too. For cash, registering is 30 cedis only. Only.
Only 30
Yes,
cities.
only.
So that means everybody that comes here, you can do it for them.
30 cedis.
30 cities
Only, yes.
in your pocket.
In your pocket. And consultation. If you have to run labs, we do that too. If you are seeing the dentist, it's 30 cedis for registration, 30 cedis for consultation only. Yes. And then you see the dentist for whatever issue that you are coming with.
So before I take a leave of you, in this COVID era, how is the cooperation with the customers, the clients? How are you coping with them?
Oh, so far so good. We work with doctors, so they take us through what we are supposed to take the patients through, the protocols. You have to wear your mask. You come, I give you sanitizer. The social distancing, sorry, is also there. And washing of the hands at the front over there. We are also observing that. And then the social distancing at the reception area is also being observed. So far, I think Ghanaians have been very helpful. Yes, they are cooperating, and we are thankful that we've not had any issues so far.
All right. So thank you so much, and enjoy the rest of your day.
You too.
All right. All right. So we're still here We'll just have to join Doc as he ushers us through various departments in here at Life Health Care. So, Doc, what do you want us to know? Where do you want to start from?
Okay, first of all, it's going to be the medical. That's the main thing here. So as our receptionist was saying, they come in, they get the details, and from there we check their vitals. Vitals including blood pressure, temperature again. We check at the door. When you come here, we check again. And then also your pulse, that's your heart rate, and then all that. Then we know how severe it is. If it's not that severe, then we know where to position you. Yes, and with that too, our ableness does that. It's called acne. So who will take you through it, and then from there she even let us know whether it's that severe. Then he let you skip the queue and you see the doctor as soon as possible. But as we said, your healthcare is our concern. Yeah. So that's the medical part.
All right. So basically, Doc has said everything. But Doc, can we just have a few word with you? All right. So Doc has said that after diagnosis and everything, you would just table to them what this patient needs or that or that. What are some of the things that have been coming to your decks as a doctor?
As a nurse,
As a nurse, okay, okay.
yes, as a nurse, we normally get people with malaria symptoms. We have respiratory tract infections. So normally, after checking the vitals, then we refer them to the doctor. Then the doctor will take them through thorough. Then from then, if he has to request some labs, we take them to the lab. They run their lab tests. Then after that, they go back to the doctor for the results to be. Yes.
As a nurse, what has been a challenge on the field with regards to patient-nurse relationship?
Oh, actually, sometimes when the patient come in, this patient is sick, so you just have to try. Some might be difficult, let me put it that way, but the patient is not really well. That's why he or she is in the hospital. So you just have to cope, and then you just try your best and provide the care you have to give to that patient. Yeah.
One thing I've observed here currently is that I can see you are just seated observing things. You should be on your phone, but you're not on your phone. You're observing. Couple of hospitals or clinics that I go, nurses are on their phones and not paying attention to clients and a whole lot. Is that a training that you guys go through before you start working here?
Yes, here in Life Healthcare, medical and dental clinic, our health, the client's health is our priority. So this is why you are here, because of your client. So when you come to work, you have to concentrate on your client, take care of them. When you go home, then you can continue with whatever you want to do.
All right, beautiful. Thank you so much, Ness, and then have a wonderful day. So, this has been the JMall Live with me, Mr. Hansen. We are inside the Life Health Care clinic inside the Junction Mall. So you can also drop your comments each and every time, and then we would revert us and when we get your comments. So we'll be going to see Doc to also take us through the rest of what we need to know inside life health care right now. So we've just been joined by Doc. So Doc, Ness has told us a lot, and I can see that one question I asked her was that she was not on the phone, even as she's not busy. Other hospitals, you go and nurses are on their phones, even when clients are not there, even when patients are there. And she said that it's a sort of training they go through before they get into this establishment.
Yeah.
Wow. So what next?
Okay, so I'll take you around and show you the different departments and then also the services that we render here. All right.
All right, so we're moving straight to some department, and as you can see,
This is the waiting area.
okay, so this is the waiting area where, as a patient, you need to come in and wait for your turn. Wow.
So, as I said, we arrange them according to priority and the severity of the condition they have. So if it's that severe, there's another waiting area very close to the consulting room, where just after seeing the client, they will know whether we will detain them a bit or we have to refer. And we do more of clinic services. We don't admit people overnight, but we do detain for about 12 hours. Yeah, so whereby we give infusions or drugs through the vein to monitor them to make sure they're a bit stable before they can go home. If we analyze and realize that they are not really too good to go home, then we refer them to a nearby hospital where they can continue with further management. Yeah.
Beautiful, beautiful. So that's what doctor has said. So, doc, we'll be going through some of the departments and see. So first,
Optical.
optical.
And we have a specialist who
Okay.
comes around on Saturdays,
Okay.
yeah, from 10 to 3 p.m.
Okay.
Yeah, so currently he's around, so you can just say
All
hi.
right. All right. So let's say hi to the optical doctor. Oh, yes. All right. So we just want to say hi to Doc. Wow. So Doc, good afternoon.
Good afternoon.
So my name is Hansen, and we are from the Junction Mall Life. What we do is that we promote the shops inside the mall to social media, where people can also view it in times of this Corona era, so that people who cannot really make a move, they can get more insight about what the shop or the mall is all about. So today we're here. We want to know more about Optic.
Okay. You're welcome to Life Healthcare. And there's the optical section. My name is Dr. Kwesi Brown, and I'm the optometrist here. But the optics is basically just about the eye. Anything regarding the eye, that's all we do here. And it's basically just the primary eye care. Anything surgical, we just have to refer. That's just about it.
So basically, someone has this short-sightedness, and I don't know much about it, but which one would you prefer for somebody who cannot see afar?
Okay, so generally, for short-sightedness, we would say it's refractive error. Okay, and for refractive errors, one can be short-sighted or far-sighted. And with the short-sightedness, it has to do with the nature of the eyeball. When the eyeball is too long, you find it very difficult to focus on images at far, because the images doesn't fall on the retina. It actually falls in front of the retina. So there's the need to um, correct that error for such a person. Now, in doing so, you would have to prescribe lenses. Refractive errors are basically corrected with lenses, okay, so that um, the short-sighted person will be able to see clearly at far. Now, when it comes to the far-sighted people, we call it hyperopia. Okay, for them, it's also due to the nature of the eyeball. When the eyeball is too short, all the images they focus at far falls behind the retina, and there's a need to project it back onto the retina for all the images, or for the once it's transmitted back to the retina also sends the impulse through the help of the optic nerve to the brain. So for the far-sighted people, we correct their refractive errors with convex lenses. There's a procedure we do to correct this, which we call refraction, and we do refractions here to correct refractive errors. Now, refractive errors can only be corrected with lenses or through LASIK surgery, but most people opt for the lenses because LASIK surgery is a bit expensive. It's quite expensive, yes. So we correct all that here, and then we have one that we call presbyopia. That's as you are aging. I mean, seeing close up or fine print becomes very blurry, and this usually sets in from 40 years and above for the hyperopes. That's those who can see well at far. So for them, once they notice that they have challenge with their near vision, we also help them through refraction to get the appropriate lens prescription, which can help them to read small prints clearly. And every 2 years, it's advisable you run a test to have your lenses changed. Yes, so that's basically about refractive errors.
All right.
We do glaucoma screening as well. With glaucoma, it has to do with the intraocular pressure of the eye. The normal range falls within 12 millimeters mercury to 22 millimeters mercury. Anything beyond that is too high. So it's advisable the client have his or her eyes checked, the IOP, that's the intraocular pressure checked. If it's high, you may have to do some investigations, that's some tests. You'll have to do maybe a visual field test, a glaucoma diagnostic test, or probably an OCT. Then we add the intraocular pressure test as well. And if the IOP is high, we put the client on some anti-glaucoma eye drops to drop it, and to drop the high level of intraocular pressure. Now, yeah, that's just about it. But then, if the condition is so severe, to the client may need um, may have to be referred to see an ophthalmologist for a surgical intervention. But with glaucoma, there's no treatment for that condition, but it can be managed. Also, it is hereditary. Okay, so if there's a trace of glaucoma in the family, it's advisable you have your eyes checked to know whether you have it or not. I mean, when it is detected earlier, it will go a long way to help you in order for you not to lose your sight. Yeah.
All right, so
Then people also present with um, general conditions like conjunctivitis. That's inflammation of the conjunctiva. But it could be through um, it could be through reacting to dust particles from the environment. So in that case, we'll deem it as an allergic conjunctivitis. Then we have those who are acquired through some infections. That's the bacterial conjunctivitis and viral conjunctivitis as well. And we have a treatment line for all that. But we don't do any surgical cases here like cataract cases. Those cases, if the condition is matured, we'll have to refer the client to see an ophthalmologist to have a small incision cataract or a phaco emulsification done for the client. Yeah.
all right, so Doc, you've no, you've really said a lot. You've really said a lot, probably, but probably the layman watching me right now, most of the time we and all what we do is we use our we rub it. What should be the best thing for us on our eye?
Okay, ideally, it's advisable to wash your face, okay, because you just don't know what has fallen on the conjunctiva or probably on the eyelashes. No, the eyelashes. So once you wash it off, it will just go off. So, and it's if it's not advisable to rub your eyes, because if the foreign body is on the conjunctiva, once you rub it, you can also get a scar. You can get a scar, which is not too good, and
What will that scar cause?
you can get a corneal scar, and that can even block light rays from entering the eye. It depends on where the scar is. If it's at the central part, like this. If the scar is somewhere here, it will be a bit difficult for light rays to go through the cornea for the person to perceive well. Yes.
All right, so Doc, finally, we just want to take a leave of you. But one question I really love to ask um, someone like you: what causes blindness?
There are various causes of blindness.
Just quickly.
Okay, there are various causes of blindness. We have age-related ocular conditions which can lead to blindness, like maculopathy, that's inflammation of the macular region of the eye, and cataract can also cause blindness, but that is temporal. Once the cataract is mature, that's for the lenses in the eye, it becomes opaque. Once it becomes fully mature, light rays cannot pass through it to the fundus, and that may cause blindness, but it's temporal because it can also be extracted for the person's vision to be restored. Then glaucoma can also, in fact, glaucoma is actually the leading cause of blindness in Ghana currently. So I would advise that should try as much as possible to pop in to have their eyes checked, because you may never know whether your vision is even good or not until you have your eyes tested. Yes.
All right, so thank you so much. Thank you so much, Doc, for giving us this office and then lecture us more on this. So that's your doctor. Doctor, your name again?
Dr. Chrissy Brown. Yeah.
So that's Dr. Kwesi Brown, who gave us a wonderful lecture on the optic and how you can take off yourself to not get your is it your iris or your eyelashes or damaged or anything. Yeah, Charlie, it's good to know all these things so that you can be safe. All right, so much.
Have his or her eyes checked. Okay, because as I said earlier, you may never know. I mean, the way you see, probably you are thinking your vision is too good. Until you have your eyes tested, you will never know whether your vision is okay or not. Yes. So that's it. So I'll urge, I mean, all and sundry, come by, I mean, when it's convenient to have his your eyes checked. Yeah.
All right, so that's what. So come by when you are free and get your eyes checked. They are inside the Junction Mall. They're located just opposite, or just opposite Vida Cafe. That's where you can locate them. Come here and get yourself sorted out. So thank you so much, Doc, once again. All right, so let's move on with Doc to other department, and then we see what the life health care has for us. We just left the optical department, and then Doc, where else are we going?
Logical department. So that one, what we try to do is that we try and take films or X-rays. Yeah, but currently we focus more on dental X-ray. We are coming up with the bigger X-ray where we can do the chest, the pelvis, and other parts too. But currently we do dental. With that one, he works on Mondays to Saturdays. Yeah, from 10 to 7. Yeah. But currently I think it's ongoing, so we might not be stepping.
All right, so currently X-ray is ongoing, so we are not eligible to enter. So let's get into other departments and see.
3 consulting rooms. Yeah, this is the consulting room, first consulting room, second one, and the third one is where we just came out from. That's the optical. Yeah.
So
And then we have the nurses station.
the nurses station.
Yeah.
So moving to the nurses station, we see knock knock. So we are live inside the JMall live. Hello. Okay, I think I need to get my BP checked. Or okay, so we're gonna get my BP checked and see. So when you come here, this is basically what you
Yes,
do,
the
right?
process. Yes, please. This is all they go through. We check their temperature.
Okay.
At the entrance, we normally check the temperature at the entrance in here. So yeah, then we check the BP. For adults, we check their BP and then their weight. But for kids, we check just the temperature and then their weight. Yeah. And after that, we do the entries inside there, so that the doctor can see the vitals.
This is temperature checking, right?
This is BP.
BP check.
Yes, please.
So what is the accurate figure of the normal BP for a person?
Yeah, we normally have a range for BP check. BP, we have the systolic and then the diastolic. The systolic and then the diastolic is the down one. So with the systolic, the range is from 90 to 130. 90 to 130. Then with the diastolic, that's the down one, from 60 to 90. So anything above 90 is abnormal. Yes, please.
So then when it tends to be abnormal, what is the next step for that patient?
Normally, before you diagnose someone as hypertensive, as having hypertension, you need to monitor it for a while, at least a week. So the person has to check morning and evening for at least a week. If it keeps being high, then you can go about and diagnose the person as a
Beautiful, beautiful. So now you checked mine. What is my status right now?
Oh, you're fine. That's 100/80. So your BP is fine.
My BP is fine. Charlie, my BP is fine. 100/80.
Yes,
Oh
please.
wow. Wow. So it should. So when someone is like 50/80,
50/80? No, it's not good.
it's not good at all.
It can be 80/50. Yeah, but it's still low. That's hypertension. Yeah.
Okay. So aside you check your BP, what other things do you do in
We
the
do
next waiting
detain.
result?
We can detain. That's if the patient's health is
Is it a
very
critical
serious, it's
condition?
critical. Yeah, we normally detain for 12 hours. Yes, so these are our beds. We detain, we give IV fluids, we have IV medications.
So you can check out the beds, and then you see is someone there?
No, please.
Oh, okay.
We don't have any
Okay, so
patients at the moment.
so we are entering the bedside. Okay, so beautiful laid
So
bed.
this is where we detain our patients.
Wow,
Yeah.
wow. Beautiful laid and all this. So 12 hours. That's where you detain your patient.
But we don't admit.
Okay, you don't
We
admit.
do not admit.
Oh, okay, okay,
Because we don't work in the night.
okay,
So we
okay,
only detain here.
okay,
Yes.
okay. So what thing, which illness, which thing that
Malaria
good?
or gastroenteritis. When the patient is running, profusely vomiting, we normally detain them for a while. Then we give IV fluids to at least, before. Yeah.
All right. So your name again?
I'm a cleaner, please. Yes.
Hey, Ewe lady. Madam Ewe. All right, so we joined Akpene, and Akpene has taken us through this wonderful tutorial inside the lifespan, life health care. All right. So thank you so much, Akpene, and I've got to know my BP stand. I'm very happy for that. I'm very happy for that. Nice one. So we'll be getting close to doctor, and then we see what next we have. We left the optical session where we met the doctor. The doctor took us through a lot of lecture with regards to how to take care of our eyes, how we can make it look more and more interesting with our viewing experience. That is it. So we are still inside the life health care where we want to know more about what they have right here inside. So, in no time we'll be joined by a doctor. You know, he's a doctor, so once in a while, doctor, a patient is in, you have to take care of the patient and a whole lot. So, and I know you be having time for us. So, don't go anywhere. Just keep dropping your comments, and then we'll read them for you. My name is Mr. Hansen, and this has been the JMall inside the Junction Mall. The Junction Mall always gives you nothing but the best. So make sure you drop your comments. Anyhow, whatever question you want with regards to where we are right now, just drop it, and then we would make it more interesting for you. So as we wait for our doctor, um, we're still waiting for our doctor though, but right after here, we'll be moving to one last shop where we'll show you more amazing stuff they have inside their shop, right there inside the Junction Mall. So this is the Junction Mall live with me, Mr. Hansen. I know do more talking, but we're still waiting for Doc. We're still waiting for Doc. So you can also have a wonderful view at the hospital where you can see the patient moving to check her eyes. Yes, so you can see a whole lot of things moving on right here. The lenses, you can see them displayed at the far end over there, So we can enter and displayed there beautifully. Beautiful lenses. The whichever brand you want, you will get it right here at the Life Health Care. Yes, very affordable. You can get them. Don't wait for your eyes to be deteriorated before you make a move. Try and make a move now. Life Healthcare are located inside the Junction Mall, Nungwa barrier. Pick a car and then ask anyone you're going to Nungwa barrier. You can locate them there and then make a wonderful move right there. So yes, my name is still Mr. Hansen. We're still here. So as you can see on their signpost, this is some of the things that they do. There's some of the things that they do. The dentists, the X-ray and the ultrasound, doctor and specialist, laboratory, This is all what they do. And as you can see at the far end, at the top there, health is a state. So health is a state of complete physical and mental social well-being, and not merely the absence of disease or infirmity. So basically, that is what they do here. Your health is their priority, no matter what, any day, anytime. Your health is their top priority. Yes. So it's amazingly good. So we're still waiting for Doctor Us, but we're still showing you in the hospital.